For those who were not able to join us tonight, we're joining here for Vancouver, Coast Salish Vancouver Health for All's meeting tonight on April the 27th. And we are working to develop a network to support frontline health and social service providers and interested Indigenous citizens and community members to come together in exploring ways that we can advance health promotion at the local level and to address the social determinants of health specifically as a key focus of this Health for All network group here in Vancouver. I'm going to turn this over now to Jenna Van Draanen, who is on the board of directors of Basic Income Canada Network. She's a postdoc with the Department of Sociology at UBC, and she's one of the main organizers here with Livable Income Vancouver, and I'm very honored to have her here and joining us tonight to share about her work and the work of Livable Income Vancouver.
Thank you so much, Sherry, and hi everyone. It's such a pleasure to be invited to be part of this group, and I hope to continue to join for future meetings as well. I think Health for All is very, very close to my heart. My PhD is in public health, and everything I do, I live and breathe public health. So I'm very inspired by what all of you are doing, and really glad to be here to share a little bit about some of our work with Livable Income Vancouver. So I have some slides that I'm going to go through. I am probably going to, so I'll do a share screen here. I think I'm going to talk for about 20 or 30 minutes. Please feel free to interrupt at any point. I would love to have some kind of free-flowing conversation as I present. And then, of course, we'll have time for discussion after. Sherry, how long shall we go for this part of the session for?
Yeah, we are very flexible. We have until 9 p.m. tonight, so take as much time as you like.
Okay.
Yeah.
Okay. Probably less than that, much less than that. So I'll plan to go for about 20, 30 minutes. And as I said, please jump in if you have questions or thoughts as we go. And otherwise we can have a bit more robust discussion after too. So is everybody able to see the slides?
Yes.
Yeah, awesome. Okay. So I'm here to talk about Guaranteed Livable Income, and that is a name that is often synonymous and also confused with several other similar terms: basic income, universal basic income, and these concepts refer to similar things, but sometimes can be different. So we'll go through all those terms together in a moment here. As Sherry mentioned, I'm part of Livable Income Vancouver. We're a nonprofit group of volunteers. We're really quite a grassroots group, and we're absolutely always looking for new members. So if anyone wants to join us at any point, we would love to have you. So there's lots of ways to get involved institutionally and organizationally, but you're also welcome to just join us, become part of our group. This is something that I do on the side. In my day job, what I spend most of my time on is mental health research, and I research the connection between income and mental health, as well as income and substance use. But I feel that I can't do that research ethically without also advocating to change our very, very broken social safety net, because it's making so very many people sick. So I advocate for guaranteed livable income, among many other things, including affordable housing and the Green New Deal that John spoke about last time as well. But I often get asked to present about this because basic income is a hot topic right now. And that's because we're facing an enormous combination of issues: increasing inequality due to extreme concentration of wealth, a growing proportion of people who don't actually benefit from economic growth. And by the way, this is even worse during recessions. I'm not sure if anybody has seen data on what recessions do, but they leave the most vulnerable in our society much, much worse off. And the top income earners actually tend to benefit from recessions. So that's something that's really disheartening to think about at this point with COVID. And even without COVID, we were seeing a worsening of really all connected forms of inequality, including race and gender. And we're also seeing economic, societal, and environmental crises that require us to think about new ways to organize our society, I would argue, and how we share resources with each other, and what it means to all work together and be part of a society. And then on top of all of that, of course, we have this global pandemic and unprecedented job loss and economic collapse. And so I'll spend some time talking about, I've been advocating for a guaranteed livable income and on the board of directors of Basic Income Canada Network for nearly a decade. And I have to tell you, in the last 2 months, it's been busier than it ever has been. And also we've been seeing more and more support. So I think crises like this help us to realize how broken our systems are and expose the vulnerabilities and the cracks more obviously, but they were always there. So as a solution, we advocate for an income that's guaranteed to all, set at a rate that allows people to live with dignity, regardless of their work status. So ensuring everyone has enough money to meet their basic needs, and then also an income that's in line with principles that we've established. So things like universality, autonomy, equality. And we also are talking about an income that replaces current paternalistic income security programs, but not replacing any existing public services, and in fact working with existing social programs. And we advocate for an expansion of the social safety net and programs. So we don't think that income needs to come at the expense of robust public services. In fact, they work much better together. So we want an income that's unconditional, universal, individual, and livable. And we have a set of principles that we use to advocate. So why? Well, there's a lot of reasons. I'm going to go through 3 of the ones that I think are most compelling. I think first and foremost, any of you who have had interactions with our income security system or who have helped other people walk through this very complex system of benefits will be able to understand firsthand that a GLI would be able to eliminate the intrusive rules and moral policing that currently take place in our welfare system. So there's a lot of this judgment and conditionality and unpredictability that's in our income support system now, and perhaps now more so than ever before. Our income assistance programs in BC include so many conditions. There's things like a work search requirement. You have to have 2 years of independence, a depletion of savings, and that's before even being eligible. And then there's all kinds of application hurdles. So having a universal payment that would be administered to all simply could eliminate some of the social stigma and paternalism for the 1.8 million Canadians that currently rely on social assistance. So with a guaranteed livable income, no one tells you how to spend your money. You're allowed to use it at your own discretion to decide what you need to use that money towards. And it gives us all a floor to stand on rather than a broken social safety net to fall into. So many of us in public health talk about upstream work and work to prevent health conditions from developing in the first place. And that's really what we're talking about here with a GLI. The other thing that I think a GLI does is it's not just for people who are workers. And that's one of the things that the Canadian Emergency Response Benefit has exposed in our system too. What we define as work is very narrow. And once you have to start putting restrictions on how we define work, it becomes clear that there's many, many loopholes, and we often don't take into account things like domestic and caring labor that is very, very, very much work. So when you send your kids to somebody else and have them watch your child, then that's work, and somebody gets paid to do that, and it's legitimate, and we respect it as a job. And if that person lost their job, well, then we would make sure that they were eligible for income support. But if somebody takes care of their own children, then we don't consider that to be work. And it's the same thing with the food that we prepare and the household chores that we do. So I think GLI also offers us a chance to look at how we define work and why we are so obsessed with this relationship between work as we've defined it and income. And we certainly have made advances for workers in our system, but those don't actually extend to everybody who does work, I would argue. So GLI can give people real agency when they're engaging with the labor market. It offers people an opportunity to say no to very harmful, hazardous, and potentially environmentally dangerous work. And it also offers, and I was talking briefly about what we count as work, but it also offers the freedom to pursue work that you love. And many people in our current system, this is a picture of an artist, but we can think of many others, do work that's unpaid or have to do what they love in their spare time and don't get a chance to be paid for that work as what we would consider sort of a legitimate job. So in this way, we could increase bargaining power for low-wage workers or for workers who are part of the gig economy, perhaps, by allowing them to decline jobs that are exploitative and allowing more discernment in job choice. So workers could fight more freely for fair wages and better working conditions and decide which companies are worth our time and which aren't. And then, like I said, we can pursue more meaningful work that's also beneficial to society. So the second main reason that I personally advocate for GLI is because we have fairly robust evidence that it works. So we have two experiments that we've done with some kind of income guarantee in Canada, ones that have evidence from them. The first is Musqueam. It was an experiment done in Manitoba in the 1970s. And the second is one that you might have all heard of, the Ontario Basic Income Pilot, which has considerably less evidence because it was cut off way too early. But we have enough evidence to show increases in mental health, so people feeling better psychologically. We have improvements in physical health as well, decreased hospitalizations, and particularly psychiatric hospitalizations, increased social connectedness and community connections, and more people finishing high school education with a GLI. So I would be happy to talk about the evidence in much more detail after if people are interested in that, but I'll leave it at that. And that's just Canadian evidence. So we also have pilot studies of basic income models that have been proposed and in some places actually carried out worldwide. And I think the third kind of compelling reason that I advocate for a basic income is because it's not just for right now. I mean, it is for right now. We've seen the importance of an emergency income supplement with COVID, but it's also for the future. So we have really, I think, quite a bit more unpredictability now than we ever have before. And this kind of flexibility that a guaranteed income introduces, it's a policy that is prepared, I think, to meet the needs of our changing labor market. We don't know what kind of precarity the next several decades will bring to workers, but there is projected to be quite a bit of job loss. The Brookfield Institute in particular suggested that 42% of jobs that Canadians currently do could be automated using technology that we already have. And we've seen many workers displaced overnight and how fragile formal labor really is, with people getting let go really overnight with COVID. So this kind of precarity is actually projected to grow, not get better, and at faster and faster rates. So I don't know about all of you, but personally, I have many working years left in my life, but I'm not very confident that the current welfare system and our current social safety net will support me through all of my life stages, but I certainly can imagine a system that would. And that's part of why I joined Livable Income Vancouver and advocate for GLI. So you might have heard about basic income in the news and really from left, right, and center these days, it seems, and I don't mean just politically, but there as well. These are screenshots taken from the Basic Income Canada Network website. There have been endorsements of basic income from associated local public health agencies, the Canadian Association of Social Workers, the Canadian Medical Association, the Canadian Public Health Association, Community Food Centres Canada, Food Banks Canada, and on and on and on and on. And these are all pre-COVID endorsements, by the way. So we have had incredible support growing behind this idea. And I think part of what takes people a while to get their head around something like a guaranteed income is that we do have a lot of people talking about lots of different versions, and we discuss our principles very, very often and what kind of a basic income we want, because there are versions of an unconditional cash transfer that actually could potentially leave people worse off and be worse for people. So some people talk about using an unconditional cash transfer to give people a small amount of money and then eliminate social programs. That is the absolute opposite of what we want. That is not the kind of basic income or guaranteed livable income that any of the groups that I'm part of advocate for. And same with these organizations that have endorsed basic income on our website. So we are endorsing the same kind of progressive basic income and a basic income that would actually help to reduce inequality in society and leave people better off rather than worse off. So now with COVID-19, we've seen a bunch of really new endorsements coming from really unprecedented places. This is just a snapshot of, it's a screenshot of a letter that was written by 50 Canadian senators to Justin Trudeau and several other political figures. And it's really quite something to see 50 senators sign on to something that you've been advocating for a decade. It's amazing, but it's, you know, we're still not there. So we have the Prime Minister and the Liberal government nationally release a program that is an unconditional cash transfer of sorts, but it's not universal. And we can see kind of I think there's parallels here between the existing social safety net that we have and the CERB that sort of keeps getting added to. We realize that it's actually really narrow to say if you've worked for this amount of time and received this amount of money, then you can have this tiny little benefit. But if you haven't, you know, there's all kinds of loopholes and people falling through the cracks. And so in recent days, we've seen the CERB expand quite a bit. And oh yeah, we forgot this and we forgot that. And what about students? And I think to me, it really speaks to the need to be more comprehensive and to have fewer limits and qualifications on who qualifies exactly for what income. Oh, this one showed up a little bit behind behind my other screenshot, but anyway, it's okay. It was just a screenshot of the NDP announcing their support for what essentially is a universal basic income, $2,000 to everybody per month while COVID is affecting us. So the NDP recently called for a basic income, and then even more recently, the Pope. So we've seen a lot of support for this policy come from different places, and this brings almost always the next question of how can we possibly afford this if it's such a good idea and it makes so much sense, then, you know, let's get it in place. And how do we do that? So I wanted to introduce you to a policy options report. It's a fairly economically advanced report. It's written so that it's understandable for even somebody like myself without any economics background, but it also has cost modeling in it. So the Basic Income Canada Network looked at 3 different models for how to fund a basic income in Canada. 2 of these are negative income tax models, meaning that those below a certain income level would automatically be brought up to the minimum income, and the minimum income that was used to model in this report is $24,000 a year, so around $2,000 per person. And so the 2 models are negative income tax, which bring everybody up to that level if they're not already at it. And then one of the models is a universal demogrant, which kind of goes the other way around, giving everybody that basic amount of money and then taxing it back at higher rates, taxing extra income earned back at higher rates from those who are more wealthy. It shows this report shows exactly how each of these models could be paid for using the existing tax and transfer system. And the way that the Basic Income Canada Network chose to offset some of the costs for the program are by increasing tax on the wealthy. And there's some other things in there like increased corporate taxation, and I believe there's a wealth tax, and there's some other progressive policy tools that are in there to not just ensure that basic income is available for everybody, but actually that it's funded in a way that reduces income inequality in the country and does not penalize low-income Canadians. economically. So I think another question that we need to ask is, how can we afford not to? So, you know, we can show with numbers that it is actually possible without completely really altering our current system, and that it's could be politically palatable. But I think for us, we need to think in public health about what we are losing by not having really robust social programs. And there are all kinds of ways that I think this makes sense economically. There are some existing income programs that could be reduced or eliminated if we just provided everybody with enough money to live, because they deserve it, because we are human, and not because they have worked for an organization that we deem to count as work. So we could eliminate existing income programs, saving approximately $57 billion at the federal level, and then more if you add on provincial level savings. Canada Without Poverty has estimated that poverty costs us between $72 billion and $84 billion annually. And so we would, of course, by investing in health upstream, save on health costs downstream. So we would likely see some of these benefits socially in many of our other systems, including our healthcare systems, perhaps our criminal justice systems as well. And we have evidence, as I said, that poverty is increasing, and some of the things that I spoke about earlier are getting worse. So without doing something, we could find ourselves in a much worse place very soon. And as I mentioned earlier, this is an opportunity to apply progressive taxation principles to actualize the kind of society that we want to live in. And then lastly, I think this is an opportunity to create more robust social programs that collectivize costs. So things like if we had universal childcare, if we had universal post-secondary education, things like that, we might not need to have a GLI that's as high as it otherwise would need to be. So right now, many of our costs are individualized, but if we had, for example, free public transportation, among other things, we might actually be able to strike a balance between individual cash transfers and social programs to create truly the kind of society that we want to live in. And I want to just draw our attention here to the fact that this is really different. It shakes up our expectations about the relationship between work and money, and it really asks us to reconsider what we consider to be valuable to society, and to revalue, to sort of readjust our values and say, well, actually volunteer work is valuable, and care labor is valuable, and everybody is valuable, not because they make a certain amount of money, but because of who they are, because we are all valuable. And then once we start to think about funding a GLI, it shakes up our ideas about how we share resources in our society, and perhaps we ought to be more sharing in our resources. I mentioned our principles earlier, so here they are for you. We don't advocate for just any kind of guaranteed livable income, but rather one that follows the principles that are universal, unconditional, livable, individual, leaves no one worse off, includes residents and refugees, is publicly funded and federally delivered. So it's a little bit interesting to be talking to a municipal group about advocating for something that's federally delivered, but I'll take a moment here to just say that the scope of the basic income movement is actually really huge in Canada. We have little networks like Livable Income Vancouver all across the country. There's now more than 35 local networks. And for the person who's joining, I think from Saskatchewan, if I heard correctly, we have 2 networks in your province if you want to join any one of the local groups there. And there are many, many in Ontario, and actually every province and territory has a basic income network. So we advocate together across the country for actually a federal program, because it would be very hard to deliver a robust income security system at the municipal level. still hard provincially, but we believe that it makes most sense federally. So we kind of aggregate our efforts, and many of the local groups also participate in the national group, which is the Basic Income Canada Network. And that network is also part of an international network that has, now it's over 40 different international networks, and it's truly global. Many of them are in Africa, South America, different parts of Asia, many of the European countries as well. And so we are well connected to a global movement of people who are advocating for this kind of change that we want to see. And on that, I would like to invite you to join us. So here's the email address for Livable Income Vancouver, and nobody was brave enough to interrupt me. So now I'm going to stop sharing my slides and just hope that we can have a little bit of discussion around this.